Well, I was conscious of the fact that a large proportion of the population over the age of 50 are said to have some degree of struggle with IT services and with digital devices. But I think one of the most important things that I've actually learned when trying to help patients to use NHS digital services is that actually elderly patients have considerable determination and ability when it comes to this sort of thing, but they just lack confidence when it comes to handling digital devices. It may be, for example, that someone has previously discouraged them by telling them that they're just too old to do this sort of thing, or they're hopeless. What it needs is just for somebody to sit patiently with them and help them to set up the relevant health service app on their device, and then just show them how to use the facilities that they particularly want. For example, the ability to order prescriptions online. It just takes a bit of patience and the ability to explain it to them in terms that they're really familiar with. For example, just by writing out the instructions for them on a sheet of paper and then letting the patient run it for themselves on their own device. When they can see that this isn't really rocket science that's been designed for superhumans, it makes an enormous difference to their confidence. Well, you quite often have patients coming through the door saying, I really can't do this. In fact, some of them, they're almost in tears when they arrive, because they may have been trying for ages on some particular system to log in, and they just haven't been able to. I think it really, you can see that just a bit of determination and the idea that you can, if you just stick at it for 10 or 20 minutes, actually log into that system. That does make a big difference to the patients. For example, there's one woman I remember who came in and she was so stressed out over IT in relation to NHS services that I couldn't even get her to sit down on the chair. She warned me that she was within about 5 seconds of walking out of the room. But I managed to get her to relax a little bit, and we went through her logging in problems, and by the end of the 1-hour session she was completely different and seemed a much more confident person when it came to doing this sort of thing. I have to accept that I'm about the same age as some of the patients who come into the Health Plus project, and I have to accept that I'm not as nimble as many younger people when it comes to handling NHS IT services and handling digital devices. In fact, very interestingly, I've even learnt things from the patients, just simple tricks on how to use my smartphone. I've actually learnt them from the patients. So yes, it is a two-way process. I try to help them, but they sometimes teach me things as well.